Hi guys, it's Metal Misty here. Okay, we are 9 weeks post-op from my shortening of the ulnar. It seems to be going well. I have a message from Alexander. Okay, you wanted to know my range of motion at the moment. Okay, so here's the wrist. Okay, so we've got a nice long line which is healing up. Still pink, which means it's healing inside still. When you after an operation, when it goes white, this is one of my first ones I had for this problem. When it turns to be a white line, then it's healed. Okay, so pink means it's still actually healing. Okay, so 9 weeks post-op, and the range of motion is pretty good. I haven't got strength in my wrist at the moment, but that's just down to the problems I've been having in the past with my tendons and ligaments, I think, anyway. So if it's just a general ulnar shortening, I've got that, and that. Okay, so pretty much you've got all the movement you need there, so you can drive a car. Okay, personally I can't push against it still. I haven't got the mobility to do that yet, which is the problem I had in the past. Sorry, that's my phone. But that maybe not your case, okay. But as in movement wise, yes, you have the full range of motion. It's not actually that bad. You can feel a little bit of the bumpiness where the screws have gone in still. I've still got that raised area here where that last screw is not quite flush with the skin, but I'm sure that will sort itself out, or maybe get some scarring on top of that or something. But that, it doesn't actually cause any issues. In fact, when I put the splint on, it sometimes rubs a little bit on there. This week, I've been able to take it off more often than leave it on, which is what the surgeons recommended. But certainly going to sleep and driving with the car, because I'm lucky enough to have an automatic anyway, but driving, keep the splint on after making sure that your insurance is okay with that still, and you're basically good to go. On the side of the insurance side, when I contacted my insurer about it, they said as long as the GP or the surgeon has given the go-ahead that you can drive, that's all good. But I've actually had to go through my insurance, then my doctor, then my surgeon to find that answer out. So just check on those 3 people to make sure your insurance is okay for driving. When it comes to motorbikes, I'm not sure how that works. So if you're using a motorcycle or a trike or something, obviously check your guys from there. But yeah, it's pretty good, Alexander. I'm pretty with happy with that. And a lot of the stuff came off of my skin was really rough and horrible. So using double base cream to make it nice and soft again is really good. And what I have found is that my left wrist, my left hand, is actually a lot softer than my right one, because I'm using my right one a lot more, and that's going in the water a lot more. So consequently, this is sort of aged like 10 years, and that one's not really aged at all. So. Okay, so thanks for your question. Any more questions, obviously let me know and I'll answer them as quickly as I can. I do have the opportunity to get my x-rays from the GP or from the surgeon. I think it's about £10 for a CD you can get nowadays, so I'm going to ask them, when I go back there next month, I'm going to ask them for a CD. And then I shall be putting up my pictures of my x-ray of my wrist, and and obviously basically show you guys what it looks like. So yeah, okay. So I'll talk to you in a few weeks' time. Good luck with your recovery, Alexander, and I really hope it goes well for you. And everybody else, good luck with that, yours as well. And if you're about to have a shortening of the ulnar, don't worry about it. It's a procedure that they've done for a long time, and pretty much it's pretty cut and dry, and the surgeons pretty much know what they're doing. So don't be too worried about that. But always ask questions before you go into that sort of thing anyway, just to make sure in your own mind what's going to happen. Okay, see you in a few weeks. Take care. Bye.